Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. New nasal vaccine may reduce whooping cough spread. A new nasal vaccine developed by Tulane University may hold the key to reducing the spread of the highly contagious respiratory disease. Current pertussis vaccines are widely used and effective at preventing whooping cough caused by the Bordetella pertussis bacteria. However, the vaccines fail to clear bacteria from the upper respiratory tract, allowing even vaccinated individuals to spread the disease. The new vaccine combines the traditional pertussis antigens with an innovative adjuvant called T-Vant, which boosts the body's immune response specifically in the respiratory tract. In a study published in NPJ, vaccines immunized intranasally with a new T-Vant vaccine showed no signs of the bacteria in the lungs and nasopharynx, that is the upper throat area behind the nose. 3 weeks after infection, the bacteria remained prevalent in upper respiratory tract of mice that received the traditional vaccines intramuscularly. Can use of lotions and shampoos during pregnancy lead to asthma in baby? A new study from researchers at Kumamoto University sheds light on a potential link between exposure to certain everyday chemicals during pregnancy and the development of asthma in children. The study analyzed data from over 3,500 mother-child pair as a part of the Japan Environment and Children Study, a large-scale nationwide research project. The key findings from the study are: high levels of butyl paraben, a chemical commonly used in personal care products like lotions and shampoos, during early pregnancy were associated with a 1.54-fold increase in the odds of asthma development in children. Exposure to 4-nonylphenol, a chemical found in some cleaning products like plastics, showed a striking gender-specific effect. Boys born to mothers exposed to this chemical had 2.09 times higher odds of developing asthma, while no such association was observed in girls. Smarter blood tests to detect diseases sooner. Researchers. Michigan State University researchers now can identify more proteins or biomarkers in blood plasma, including those linked to specific diseases like cancer. The new method takes a deeper look at the proteins in plasma and reveals biomarkers that enables researchers and ultimately physicians to detect diseases sooner. The findings are published in Nature Communications. The ability to identify biomarkers advances medicine in 2 key ways, said Morteza Mahmoudi, Associate Professor in the Department of Radiology and Precision Health Program in the MSU College of Human Medicine. First, using a simple blood test, diseases can be identified and diagnosed earlier. That means faster treatment and better patient outcomes. Second, it helps clinicians choose the most effective treatment plan. For example, if a clinician knows that at a very earliest stage of cancer that it's metastatic, their approach to treating and managing the disease would be totally different than if they know that the cancer is benign. Small molecule modulation of protein corona for deep plasma proteome profiling shares their new methodology for deep analysis of proteins in plasma. WHO and partners strengthen efforts against cervical cancer. As world leaders arrive in Rio de Janeiro, Brazil for the G20 summit this weekend, the city's iconic Christ the Redeemer statue will be illuminated in the color teal. The Brazilian advocates behind this effort are among many around the globe, joining the World Health Organization to mobilize efforts on a worldwide Day of Action for Cervical Cancer Elimination. Other countries are marking the day with campaigns to provide human papilloma virus vaccination and screening, launching new health policies to align with the world's first ever effort to eliminate a cancer and raising awareness in communities. 4 years ago to the day, 194 countries resolved to eliminate cervical cancer and WHO launched a global strategy. Since then, significant progress has been made. At least 144 countries have introduced the HPV vaccine. Over 60 countries now include HPV testing in their cervical screening programs, and 83 countries include surgical care services for cervical cancer in health benefit packages. I thank all the health workers who are playing a critical role in this global effort, said Dr. Tedros Adhanom Ghebreyesus, WHO Director General. While we are making progress, we still face huge inequities, with women in low-income countries bearing most of the burden. Only with strong leadership and sustained investment can we achieve our shared goal of equitable access for communities most in need. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.